All right, welcome to the IFAM seminar series. It looks like folks coming in from the room is slowing down, so we're going to jump right in. We'd like to welcome you all to today's seminar, which is fully virtual. Usually we enjoy being in hybrid format and being able to be with you in person, and we thank you all for joining virtually due to the weather this week. We would like you to please be aware that we will not be monitoring the chat during today's presentation, so we ask you to please use the Q&A function, and our two esteemed speakers and panelists will answer your questions to the best of their ability during a formal Q&A. So without further ado, it is a professional and personal pleasure to be able to introduce today's two speakers, Dr. Ashley Knapp and Rob Simmons, who, as you will soon be hearing, are truly a powerful, multidisciplinary, dynamic duo that's been working together for the last half decade. I learned during our practice time. Dr. Ashley Knapp is an assistant professor and core faculty at the Center for Dissemination and Implementation Science at Northwestern. She holds departmental affiliations with both psychiatry and human behaviors, and also medical and social sciences. And she leads a dynamic research portfolio right at the nexus of community-engaged research and implementation science. She has been the principal investigator of 2 grants funded by the National Institute of Mental Health and an impressive 7 pilot projects funded by a range of foundations, departments, and organizations. In 2023, she became an Implementation Research Institute Fellow, which is a prestigious national honor for implementation scientists early in their career. And she brings to her work a lens through her training and master's degree and PhD degree in both experimental psychology, both from the University of Arkansas. She is joined today by Rob Simmons, who is currently the Director of Social Services and Public Safety at Oak Park Public Library, a role that he has held since March of 2016. Rob is one of the first social workers hired to integrate a social services model into a public library system in the entire country of the United States. His innovative work has resulted in programs that provide extensive resources to the community, including free mental health assessments and counseling, educational support for low-income students, supporting housing advocacy and employment assistance. And he brings to his work a lens through his training and bachelor's degree in human and organizational development from Vanderbilt, as well as a master's degree in social service administration from the University of Chicago. Most importantly, before I conclude, it's important to know that Ashley and Rob and the work that they are presenting today were honored recently with the 10th annual Dr. Virginia Bishop Community Academic Research Partnership Award by the Alliance for Research in Chicagoland Communities, an award that is orchestrated by the Center for Community Health here at Northwestern. This award recognizes exemplary partnerships that use a community-engaged research approach to impact the health of the community, and I'm certain you will all agree that this project is exceptionally deserving of such an honor. So without further ado, I'm going to turn it over to Ashley and Rob to take it away.
Thank you so much. What an honor to be introduced by you, Sarah. And I can speak for Rob. We're so excited to be here and be able to share what Sarah said, a half decade. And Rob, I hope you don't mind me sharing. He was saying his oldest was in elementary school, about to go to middle school, and now is in high school. So that also gives you an idea of how much fun we've had over the past 5 years. All right. First, before we get into our partnership development as well as the study, I just want to do a little bit of background to show you why this is so important, and especially the demographic that we're targeting. So, oops, sorry, 1 second, please. All right, so adolescence is characterized by considerable biopsychosocial development, driven in part by complex bodily changes related to puberty. So what we see in a relatively short amount of time is teens reach skeletal maturity, as well as develop primary and secondary sexual characteristics. And so along with this rapid growth in physical characteristics, we also see the emergence of cognitive competencies, such as mental health reasoning. Oopsies. And what's kind of what I find really interesting of this period is this paradox. So we have this robust physical health, this robust development, and we also what we also see is just whenever psychological vulnerability is transformed to clinically relevant psychopathology. So it's also been defined as a core risk period, and what we know is anxiety disorders are one of the most common disorders within adolescence, and they really impact teens. They impact their functioning, like school performance, their social relationships, as well as their physical health. And what we also know is it increases the risk for other psychopathology into adulthood. What we also know about this developmental period is adolescents are digital experts. They've grown up and have been surrounded by technology. I feel like since birth, but just kidding. They're very much more digital experts than I would verge to say than we are. And what Pew and one of my favorite places to grab this kind of research, what we see here is that yes, no access to smartphone is nearly ubiquitous. I will emphasize that access, I think, is granular. So this could be yes, no access to, they have their own cell phone, or maybe they share it with a family member, but we do see nearly ubiquitous access. And what's also what I think is super fascinating is this is so about nearly half of teens say that they use the internet almost constantly. And as you can see, this has doubled since 2014, 2015 to 2022. So it's crazy how much they are on the internet at least several times a day, if not almost constantly. And what it suggests is it's a promising modality to reach and engage teens. We're all familiar with this research to practice gap. Digital mental health interventions aren't immune, and I would even say not gap, chasm, in that hundreds of randomized control trials for digital mental health interventions, they've shown consistent efficacy. However, the majority of those have failed at real world implementation of those interventions. One reason of this could be, as scientists, we usually use this top-down approach in which we decide the main intervention themes, use technology to try to persuade users to do what we believe will lead to improvement. Or if you're teens who I chat to, I say, us scientists think we know all the things, and then we put it in intervention and scratch our heads whenever it doesn't lead to the engagement or to the outcomes that we think. And this top-down approach, it just doesn't consider how people engage with technology, their own personal goals around the use, or the context in which it's embedded. And importantly, typically interventions are not tested in the environment in which they'll be deployed. So ultimately, all this to say is interventions have traditionally not been optimized for use in real-world settings. How I like to demonstrate this point is with kind of a fun blurb. All right, so all of us got into weird things during the pandemic. Mine was I watched and loved all of the Alien series. I don't think I'm ruining anything, but just to acclimate you to this scene. So this is Elizabeth Shaw with her back to us, and she is impregnated by an alien. And in order to live, she needs to go to this, what's called a med pod, or kind of like a robot doctor, and get that alien out. So she goes up, excuse me, to this med pod, and she says, please, the med pod says, please verbally state the nature of your injury. And she says, I need a cesarean. And then the med pod responds, the med pod is calibrated for male patients only. Whew. So I paused the movie, then got up in arms and was talking all about this. But I think this is a good example of top-down approach where male scientists created this med pod and didn't think about or didn't take into account female needs. And I think we do this so much within science, where again, as scientists, we put what we think we know, but we don't know all of user needs. We don't know all of also the expertise of users. So I kind of a silly example, but I think it's a really good one to show that we have to include users. We have to include the community in the interventions that we create. And Rob, I'd love to hear from you.
I think Rob is on mute.
Oh, Rob, you're muted.
I apologize. Within the past decade, there's been a national focus among public libraries to prioritize equitable approaches in serving people experiencing poverty and mental health difficulties, particularly in urban, suburban, and rural library environments and systems. And when I was contacted by Ashley to really, examine access to tools, to any kind of interventions to help teens manage anxiety. I was very excited. And I think what really makes this partnership special is that we were really able to listen to marginalized BIPOC teens and also adults who engage and work with teens internally and also externally to really figure out what a tool would be to help teens address some really, challenging, I would say, issues around managing anxiety. So, this opportunity to work with Northwestern and particularly ASU for 5 years has been amazing. Another great thing is I've been able to work with libraries locally and nationally to talk about our partnership with Northwestern and also talk about our overall social services model to help encourage and help other communities across the country build meaningful partnerships to really help address and help folks work through mental health difficulties.
And I say it's equal joy to have been working with Rob and other folks at the library. I'll brag about that later too. And I will say too, just to add on to the wonderful things that that Rob said, is it seems like there really has been a shift within the U.S. libraries to where they're really responding to their patrons or folks that visit, and mental health seems to be one of the top ones. So it's been kind of fun, just nerdy fun, as the just the commonalities that we really saw when we started partnering together. Beep. Ooh. Okay. All right, so just going to give a brief project overview, and then we'll get into partnership development, which I think I will emphasize is such an important part of community work. So the big goal of this project, especially the research part, was to design a technology-enabled prevention service, particularly for teen anxiety, and within that, to partner with the community organization. So as you know by now, the public library, and also include adolescents or teens and other stakeholders in the design. And the ultimate goal, what we're hoping to do, is design a widely accessible service co-designed by teens and community partners to be sustainably implemented into an organization who serves underserved youth. So now I'm so excited to hear from Rob to chat about our partnership. Oh, you're on mute.
So to help mitigate social isolation for our patrons and also our organization, we've been intentional about building relationships with clinical research partners such as Northwestern, local and regional social service providers, organizations such as Chicago Rush Medical Center that provides direct clinical services on site to our patrons. All of this work of intentionality behind partnerships has really helped not only our patrons needing access to much needed resources, but also has helped our library system. When I first started, there were two things that were apparent: that we had to, in an expedited fashion, build relationships to get folks some much needed support, but also we needed to be partnering with social services and also public health entities to make sure that, I'm at the table particularly to help share our story and also be at tables that are talking about making and creating more robust social services and also public health support, particularly in library systems, because our library system really needed that. Next slide, please. So just to give you an example of some of the things that we do as far as providing, or going outside of traditional library services, is that I participate on a Oak Park Village Managers alternative call response task force. This participation for me has been very rewarding, but also very important, because our library system, particularly at our main branch, we have to lean on crisis intervention trained police officers, but also there needs to be more intentionality behind building alternative call responses where instead of law enforcement officers being deployed into the community, we have more mental health professionals instead that are engaged and deployed to work with folks that are experiencing mental health crises. So I worked for over a year with the village manager and other key stakeholders to help even provide that infrastructure. So that helps us internally, but it also helps us externally. And it also shows to the community that libraries are our library system particularly is very invested in making sure that we serve everyone that walks through our doors. Next slide, please. We've been really intentional about partnerships and hiring that focus on interdisciplinary approaches. It takes many perspectives to help libraries serve patrons that are experiencing poverty and mental health challenges. I found that working not only within my community of Oak Park where I work, but also nationally, that there is a shift of libraries hiring really, I would say, folks that are not traditional librarian trained, things of that nature, to address many needs of the community. And to see this shift is very rewarding. I'm so glad that 8 years ago, our executive director at the time decided to, hire a social worker, look at models such as San Francisco and also Colorado, Denver Public Library System, on really building infrastructure to help some folks that are in dire need of mental health support. And now we have our incident reports have gone down because we have infrastructure within our system. Our partnerships have definitely helped people that need the support move into a continuum that expedite them receiving much needed services. So I'm very, very happy about the work that we've been doing, but also the work that we've also been doing with people regionally and nationally as far as library systems to help create such infrastructure.
All right, now Rob and I are going to chat about our partnership development. Again, I think this is such a critical component of community work. And so I just wanted to tell a little bit how we did it, what we found successful, and also honestly, what we learned from the community. Oopsies, I make funny sounds too when I'm scrolling, apology. All right, so this was actually funded by Northwestern's ARC, Alliance for Research with Chicagoland Communities. And I will say, actually, the call is out now for both seed grants and research grants. So it's a great, it's a really fabulous help. And so let's see. So we received this, and what we were really interested in doing with this was getting to know the community, getting to know the gatekeepers, and especially me, starting to earn the trust of the community, because Rob is in the community so much and has earned that trust. So we also were able to fund 2 teen investigators, and they helped us form and facilitate 2 advisory boards. And again, and what we wanted to learn about is what are the community strengths? What are the mental health resources that are already available? And what's important to me, and I'll talk about this a little bit at the end too, just to encourage other folks, is to talk about the past harm caused by researchers and academic institutions. We've done a lot of harm, and I think it is for me, it's been a really good conversation to have, of taking on even the harm that I didn't do, but being then aware of that's how they've been harmed. How do we not do this? And then being open. And then also just the role of library and teen mental health. What do folks think about that? So first, you'll get to hear from our teen investigators. All right, and then just prompt me if you can't hear them.
Hi, my name is Kalei Clark. I'm 18 years old and I'll be attending Bradley University in the fall, and I am one of the teen investigators in this project.
Hi, I'm Saida, or Sai Rucklutner, and I'm the second teen investigator in this project. I'm 18 and I'll be a freshman at Dillard University in New Orleans in the fall. I have been an active member of many library programs, including the Teen Summer Volunteer Program, the Mural Project, and the Living History Project.
Both Sai and I got involved with the Teen Advisory Board at the library through another program called the Living History Project. Living History is led by a longtime social justice and human rights activist, Billy Books, or Billy Chake Books.
We got involved with the advisory board when Dr. Ashley Knapp asked us to help facilitate the teen relations of the research study after participating in it. Our role was to relay information from the meetings back to Dr. Knapp. We partnered with Dr. Knapp to make this investigation more accessible to the community and the teens who are the focal point of this investigation.
As the first teen investigators for this project, we have shaped the role and responsibilities. Some of these roles included choosing teen and adult board members from the community, generating questions for the meetings, and facilitating the group.
One of the biggest takeaways from this experience was being able to work in a professional setting and take an administrative role in a project. This included preparing for professional meetings, advising groups, and communicating with each other as a team. So thank you to Dr. Ashley Knapp for giving us this amazing opportunity.
That is our, I feel like I just beam with pride every time I see this video. They were so fabulous. And like they said, they helped choose members from the community, and they facilitated. And I loved it so much because they took on that role so well. And that I remember raising my hand and be like, can I say something, Sai? And she's like, whoa, you need to wait until this person's done and then you can talk. So I love that they really they did a fabulous job. And I think their perspective was so important because the follow-up questions that they asked advisory board members, both teen and adult, we just wouldn't have asked. And so next I'll show you guys, we were able to hire a graphic recording artist. And what that means, what that means is, and it's Sarah Yokimoto, and I'm happy to provide her information, but she's on the bottom left. And yeah, so basically what she did was she came to one advisory board meeting with adults and one advisory morning with teens, and then created this beautiful thing. So Rob is going to talk us through this one.
So I think very important component of even creating an adult community advisory board is the participation with teens and the investigators and the many teens who participated in the project and are participating in the project. Initially, when we were thinking about, who do we invite, things of that nature, we were like, well, we need to depend on the teens and hear their input. So the teens told us a lot and gave recommendations and helped us really recruit adult community advisory board members. And I would tell you, it's a very, very diverse community advisory board. There were parents, educators, social service providers, just Oak Park residents. We had some professors, a wide range of folks that really participated. And what was nice about the advisory board, the adult advisory board, is that a lot of those adults are very familiar with Oak Park and some of the teen challenges and needs of the around teen support for the community, but they also work closely with the teens and families. And as you'll see, I just point out the four bubbles. What came out of some of the, I would say, graphic design information that we have is what are the strengths of our community? Also, what about teens who don't want their information shared publicly? There is a history of, I would say, Oak Park having like a call center or some interventions are focused around programming to help teens. And what usually happens is they'll ask information on the front end, and then teens kind of get stuck in a continuum, like, oh, they, and it makes teens feel like they got their information, but we're not getting what we want. So that was, I was happy that was acknowledged from adults as well, that was happening or is happening. Another, question that came out of it was, what about teens who don't have consistent access to a phone? And also, how can we ensure the app can be accessed by all teens in Oak Park? And those just generally those four areas and questions are there's a lot of ways you can go with that, but we really took time to inspect that, try to come up with some sound answers, and working with the teens in the community. And I'm so excited that we had a very good success in creating an advisory board, and we got a lot of good data from that.
And thank you so much, Rob. And I'll walk you guys through the teams. Again, this is the same graphic recording artist, and she just created this while she listened to all the pearls of wisdom from the teens. I won't be able to go over all of it because look how much wonderful information, but just like Rob kind of pointed out the highlights, the talk bubbles that are in purple, I'll focus on those. So what we loved and learned about the strengths of the community, youth were like, Yes, we are. We have a lot of passion. Also, elders in our community, they hold so much wisdom, is what teens told us. And we were really challenged in a good way. And we're continuously challenged in thinking about this of take initiative to center BIPOC teen voices. They also, which I love, teens just tell it to you straight, resist performative commitment and racial justice and do the work. We also talked about the current mental health resources and how they're really insufficient, especially for BIPOC youth. They talked a lot about how the therapists in the community are overwhelmingly white, and not only that, they're just not really interested in the cultural relevancy of them as a patient. Also, the local mental health nonprofits, they really don't center BIPOC youth. And then we had a really wonderful discussion on reach. So how do we make sure we're reaching all this population? And just amazing other pearls of wisdom. And again, Calais and Sai facilitated all of this, and we just had so much fun. And I just love this too so I think for researchers, maybe put in your toolbox, this is such a wonderful resource to show back to the community and show what you've learned in a way that is not boring like we normally do. What? And just, yeah, so happy to chat about it and give Sarah's information as well. All right, so for the next little bit, I am going to nerd out and talk about data that we've collected over the years. So just to give you kind of an overview, I'll talk about needs assessments that we did with both library workers and teens, and then hot off the press, never been shown before, we have a design workshop data to show you. As you can see, I'm very excited about that. All right, and then I also say that the needs assessment interview library for library workers is a published paper, so I won't go into too much, but we have a QR code at the end if you're interested and want more details. All right, excuse me. So we have where we had 17, or I worked with 17 library workers, and they were all across the spectrum. So there were librarians, there's executive directors, board of trustees, front-facing workers, or those folks you see when you just come into the library. So amazing, really wonderful perspectives. It was about an hour interview. We talked about roles and workflows, how they use technology in their environment, teen services programming, and then also preferences for anxiety tools for teen patrons. For this particular data set, I was really interested, or I put my implementation research hat on, and I was really interested in, how do we understand more, or for me, especially my research team, understand the library environment, because that's new to me. I've never worked with libraries. How do we understand that infrastructure? And then also, coding, we used what's called the Consolidated Framework for Implementation Research, or probably you've heard CFR more often, and it's what's called a determinants framework. So what we were really interested in, where the determinants are just a fancy word for barriers and facilitators. So to kind of put a context to this, what we're really interested in, what I'll show you is, okay, in the future, whenever we're implementing mental health resources, what are some barriers that may trip us up that we need to think about? And then facilitators, what are some things that are already there that we can use to help optimize implementation? So I'm going to walk you through, just kidding, to know what the sample looked like. It was 17 library workers, but to protect the privacy, we are reporting, or this is reporting on race, ethnicity, and gender identity of 128, so everyone that was employed. So it's about majority white, a little over 50% folks identify as white, about a quarter identify as African American, about 12% Hispanic Latino, 5% as more than one race, and 3% as Asian American. And then as you can see here, majority was female with about 62%, and then 35% identify as male and 3% as non-binary. All right, the results. Hopefully you guys nerd out on it like I do. All right, so with the implementation determinants, and remember again, those are just fancy words for the facilitators, which I'll focus on here, which is what's already existing that we can really help us in the implementation. So inner setting, this would be the library in particular, the library that we're working with. what we learned is the function is library workers in the library really serves as a conduit in connecting patrons to different services and different resources. What was also pretty fabulous and what we learned, especially for digital interventions, is libraries have availability of broadband, computers, other technologies, all for free that they can rent out. So I think when thinking about accessibility, this is really important, of making sure that if we're going to implement a digital intervention, do the users, or teens in this case, do they have consistent access to broadband, to a smartphone, or to a computer? So all that is so wonderful that it's already there and can be rented for free. And then, as you probably learned from our talk already, there's a high compatibility between the public library and the research team. We're very invested in teen mental health, and yeah, again, it's just crazy how much overlap there was. All right, so outer setting. This would be what is the setting that the library is in, and if facilitators. So what's there that could be helpful in the future. What we learned was a strong local network with local external organizations, so schools, park districts, and other entities. And similarly, across the other 2 bullet points is I'm so amazed by the library, but their connections to free community mental health clinics that they could provide, I guess do a warm handoff to their patrons. And then I also loved learning about their intergovernmental agreements. So this is where interventionists, interventionists who are adults but work with teens, they actually come to the library and provide those services, and within this intergovernmental agreements. And then the last slide that I'll show you on this, again, so much fun information. I'll give the QR code at the end, but we really wanted to also learn about barriers. Okay, what are the things we need to think about and create strategies for when thinking about implementing digital mental health interventions, or mental health interventions, digital in particular. So what we learned, the barriers, so inner and outer settings, what we learned is some previous programs were not designed to meet the needs of and further marginalized, historically underrepresented racial and ethnic teens. And so I think this is a big, really, and Rob spoke to this. This is really important to us, and also how we overlap. They also talked about a lack of teen-specific mental health resources at the library, and they also talked about stigma and confidentiality. Confidentiality is such a hot topic, and I think any teen researcher would tell you that having to get permission from a parent for teen mental health is a huge burden, and a huge burden for that teen to get access. So they talked about that, and how even sometimes parents served as gatekeepers to those, and actually adults in general, serving as gatekeepers for teens to access mental health. And then characteristic of individuals, so really focused on library workers. What we learned from library workers, they're like, hey, we weren't trained in this, we're librarians. So they had low confidence and limited training in mental health. And they also told us that they don't really know where or how to identify effective and teen-specific mental health resources. So again, with these barriers, what I love about implementation science is it's not like we sweep these under the rug and be like, oh, limitation section, but we're going to think about these and create strategies so that we can kind of overcome these things when we move forward with implementation. All right, so gonna continue the nerd out session. All right, so now the rest of the data will all be teen perspective, which I think is so underrepresented in the research, and I'm so excited to be able to tell their stories. So we also did a needs assessment interviews with 16 teen patrons, 12 to 18. We asked a lot of questions and have so much wonderful data for this. We have anxiety-related questions, asked them about what are some safe coping techniques. Do they prefer digital or non-digital program for teen anxiety in the library? What are some barriers? And then what I'm going to focus on, again, just the brevity of the presentation. Excuse me, I'm going to really hone in on what they thought about the role public libraries should play in teen mental health. And we used thematic coding to analyze the different transcripts. So to give you an idea of what the demographics looked like, a little less than half teens identified as white, about 44%, about a quarter as African American, about 13% African American and white, and about 13% identified as Hispanic and Mexican American, and then about 6% Chinese American. We also had pretty good representation of gender identity. So again, more female, but about 50%, 56%, 31% male, and 13 identified as non-binary. All right, so again, just going to focus on this data because with qual data, I could talk to you guys all day. But what we learned from the teens was the central location of the libraries. And I love this quote. I think it really speaks to this. Because of where I get off at the train on the metro, I get off right across the street from the library, so I can go to the library and just chill there. I think this, from learning from the teens and the adults, it always is a central location. And if you think about it, even the most rural towns have public libraries. I grew up in Arkansas in a 2,000 person town, no stoplights, and we had a public library, a beautiful public library. So the central location of libraries and the easily access point. So already talked about the access point, provision of resources. As Rob was just saying, they've already started providing these mental health resources, and teens are using them. And they underscored that they believe it would be an excellent place also just to be more culturally relevant with those resources and teen specific. And the last thing, and then I'll show you a really good quote that I think emphasizes all these points, is the teens talked about what a safe space the library was. And with that, one of the things that makes it such a safe space is the trusted adults, how they're there for them. And again, sorry, excited about results. Consistency with those trusted adults. They consistently showed up. They're consistently there at the library. And I'll read you this quote, which I think, again, perfectly summarizes. This teen says, I was always at the library, and I was always doing these groups and these fun summer clubs. I had a lot of friends from the library. I do think that the library is a great resource place. There's a lot of good, trusted adults. It's quiet, and sometimes in a hectic household or a hectic friend fight, you just might want to go to a place and feel welcomed and feel quiet and feel calm. And this was just echoed by so many teens, just the safe space that they found the libraries and how many friends they had at the libraries and how much they already used the programming. So that, again, I have more to say on this, but I'll have to put a pause and happy to chat. But I wanted to give you the teen perspective of public libraries and mental health. And I couldn't find a hot off the press emblem, so I found breaking news. So these are the new results that we just had so much fun gathering actually in December. All right, so what we did with teens was I showed them this slide, actually. I called it a nerdy drawing exercise. And I asked them to divide the paper up. I gave them sheets of paper. You'll see in a second, actually. I was about to grab for one. Sheets of paper into 3 sections. The first section, draw out how they experienced anxiety and stress that day. And what are some of the thoughts, context, feelings, bodily feelings? Did you use any tech? Were there any warning signs? Then the second or the middle section, I asked them to draw out what they did that was safe to help work through their stress, and asked them, was there any tech? And what advice would they give? Or if they couldn't think of anything, what advice would they give for friends struggling with anxiety? And then the last section, how did they feel after? Were there any change? Did they use any technology or anything like that? Yeah, so to give you an idea of what this sample looked like, gosh, we had the pleasure of 19 teens. And we had a wonderful representation of race and ethnicity. Please note this is over 100%. I know, but this is because we asked them to check all that apply. So there were some teens that identified with more than one race. So we'll see about almost half identified, or 47% identified as white, as well as African American. Almost a quarter identified as Hispanic or Latino and Asian American. And then we actually had representation of teens from Native American or American Indian or Alaskan Native background. Gender identity, pretty similar, I think, to what we saw last time, of mostly female, about 58%, 37 male, 5% non-binary. And then I also included these statistics because in kid research, it's usually not really reliable for teens to report on their household income. So we usually ask if they qualify for free or reduced lunch. And we had a pretty good representation of this as well. So about 40% or almost 40 said that they were qualified, whereas about 60% said no, and 5% didn't feel comfortable sharing. And then we also asked about their LGBTQIA identity, if they were identified with any identity within that umbrella. And again, we saw pretty wonderful representation. About 35% said they did identify under that umbrella, and 58% said they did not. And then there was some folks that prefer not to disclose. All right, so that's what the demographic looked like. Now we can go into the fun things. All right, so these were, and I'll go into detail, but these were the drawings that that teens came up with. I'm so excited. Okay, so a reminder on the, oops, let me get to the big, yeah, there we go. On the left, this is how they experience anxiety, how they cope, how they feel after. As you can see, there's just such diversity in the way that they portray it, but the way they feel it, but there's also a lot of similarities. As you can see, within 3 of these, 1, 2, 3, all of them used music as one of their safe coping mechanisms. And then this was one of my favorite description. Oh, sorry, I realized I'm not, oh no, okay. The top right with just the scribbles, that was one description. And I loved that. I think that is such a good description of anxiety, is this red just squiggles is how they feel. All right, so I'll go into a little bit of detail just to show you how rich with data this is. Yeah, so this teen says how they go through anxiety. I get it, and I'll quote them, I get an odd chill and feel like I'm up somewhere high about to fall. And that's their picture right here. If it gets to the point of an attack, I can shut down and lash out. Also very fragile and jumpy. And then with the middle, what this individual said, how I deal with anxiety, headphones. Again, music was so important to so many teens in coping. If headphones, oh, and this says with music, OBVIO, so I guess a little short version of obviously. If headphones or music aren't available, I fidget with my clothes or anything available. In my own time, it's always music or my favorite shows. Like there's this specific episode of my all-time favorite show, just Distractions. So this is the all-time favorite show. She explained it to me. I forgot what it was, but something that made her giggle. Or made this individual giggle. And so how I feel after anxiety, if it's extreme and late, I'll probably pass out from exhaustion. Normally it's like nothing ever happened. And I'm like, get the same, sorry. Normally it's like nothing ever happened. And I'll get some, oh, that's what it was. I like to get something to munch on. And believe it or not, this is Jimmy John's. And she was saying, or this individual was saying that their favorite place to go get munchies after feeling stressed was Jimmy John's. And then I'll talk about, let's see, how are we on time? Okay, good. All right, so I probably won't go into this too much, but I loved how they used the little cat figure. And I just, their illustrations are beautiful. So as you can see, heart pounding out of the chest. And this person said, I have anxiety by my heart beating super fast and my body gets shaky and I stutter a lot. I said I wasn't going to go into it, but I already did. So I'm gonna finish it out. And then they said they like listening to music. Again, that was really popular, talking to friends or sleeping as depicted here. And I love this serene picture that they gave, but they feel calm usually afterwards, or they just feel tired, or they want to talk more with friends, which is depicted. And so what we did was everyone drew their own drawings, and then we asked for volunteers to talk about what they drew and what they wrote out. And again, it was so much fun. But anxiety, what we learned, just cloudy thinking, and I included the squiggle because I think it's really representative. They talked about coping, and music was really big, art, deep breaths and counting, TV shows, sports. Oh yeah, basketball was talked about a lot as a good coping mechanism. And then how they felt after, recharged, rejuvenated. This was me trying to mimic they had a really good picture of their brain, and they said the brain was stimulated. This is my bad drawing of it. Yeah, so taking a step back, this was so helpful to learn how teens are experiencing anxiety, what are their particular symptoms, and also what do they use already that's safe, so that when we're thinking of the intervention, let's use things they already use that we know works, in addition to the literature. All right. So then we also, let me step back. I've had the joy of working with, her name's Simrandeep Kaur. She's actually located in India, and she has been volunteering with us and doing beautiful graphic designs. So all but the bottom left, she created. So library Be Well is what we came up with. It was my idea to do the B. I would have put it aside if teens didn't like it, but they did. And so what they wanted and gave feedback is, I love here, hate bottom left. This was in Canva and they didn't like the B and they thought it was boring, but they actually really did like these designs. And it was so good to get their feedback. And I will say they actually liked the the hive most, and the little bee. Yeah, so we got feedback on the logo as well as the design. And then we were also really interested in prizes or rewards and progress, thinking how do we increase engagement with the teens? And so again, they gave us such fabulous feedback. With my implementation hat, I wanted the prizes to be what the library could provide. And the library actually has a recording studio, which is pretty hot with the teens. So they were like, okay, yeah, we'll take that. That's a good one, but all the other ones, no. And so what we really learned was candy and food are the way through their stomach to their hearts, or to their brains. But candy and food, that's where it's at. Gift cards. They also talked about swag, especially with some of the emblems that I showed you, either the hive or the bee. And then also we talked about how to promote on social media, and they, of course, gave such wonderful feedback. All right. So when I get to this point in listening to a talk, I'm like, whoa, that's a lot of data. Ashley, please help me summarize. And what are you going to do with all this data? So just to kind of condense it and make it a little bit more palpable, edible, to make it a little bit more accessible. So public libraries, what did we find out from library workers as well as teens? It's a central location. It's off the metro, or it's right off the train stop. And they have high reach. Again, a public library is in every town. And just how rad that is to think of a deployment organization being in every city and town is phenomenal. Also, we learned that library workers and libraries serve as conduits, so they bring the resources to the community, and not only promising space for mental health tools for teens, but as Rob said, they're already doing this. They're already doing free mental health assessments. There are already tools there, and also again the safe space and trusted adults. Teens really appreciated that about the library. And one of the reasons they kept coming back and going to programming. And for digital interventions in general in libraries, what's pretty wonderful is that the facilitator, that kind of that bonus is that is already there of most libraries, and Rob will have to check me on this one, have free access to broadband computers and other technologies. Rob, is that right? Okay, I got the thumbs up. Good. All right. And then lastly, the intervention adaptation. So what we're going to do is use these real anxiety experiences as examples in the intervention, and also incorporate what coping mechanisms they already use and we know is successful. We got the push, and I again love teens for their transparency. We really want to and will and have been pushed to and will be kept accountable to include historically underrepresented racial and ethnic teens, their needs in particular, and also ensure cultural relevancy, because as we heard both from teens and library workers, there's not so much of that easily accessed by teens. We also got feedback on the logo design, so I don't have to ditch my B. Yes. Again, I would have if they said they hated it. All right, and then we now know how to highly incentivize awards for using the intervention. All right, so just 2 more slides, and then we can't wait for questions. So future directions. Rob, Ash, where are you going to go from here? So exciting news of we start collaboration with Dr. Jessica Schleider, who's now at Northwestern, and she is one of the world experts in SSI, single session interventions. So based on the feedback that we got from teens and library workers, we were able to choose about 5 of her interventions that were based on the recommendations by teens. And we're going through usability testing right now. So both within the library, but then in the wild. So they'll use the interventions for a week. And then thinking in the future, what Rob and I are doing now is we've located some pilot funds and are applying for those to get national data. I think that's what I've heard from my mentors as well as others of, in order to have a successful R01, you really need to think and collect national data. So that's what we're doing. And then Rob and I will submit a R01, hopefully this fall is what the goal is. And that's our next step. And then I'm trying not to get a little preachy, but I want to end with a call to action. Working with community is a privilege that is earned by us scientists. Institution research broadly, we've done a lot of harm, guys. We've done a lot of harm to Chicagoland communities and in particular marginalized communities. And here are some lessons that I've learned on how to show up. And first I want to shout out to ARC, I mentioned it where we got our Partnership Development Grant, Alliance for Research in Chicagoland Communities. Jen Brown is the director. She's rad. They have so many resources to learn. They have a anti-racism reading collaborative. They also have really other wonderful meetings where community members speak and tell us researchers how to do well by them. So here's what I've learned. And Rob, I'd love your feedback too. But so show up beyond research and earn their trust. What does that mean? Whenever someone gives me advice, I really want it to be tangible. So this isn't like, yay, Ashley, you did great. This is more just examples of how you can do this. So I attended, and Sai and Kalei, the teen investigator, spoke to this. It was called Living History. And it was this beautiful program. Every Wednesday night, we'd log on at 7 p.m. and teens would learn about a social justice issue and then give a town hall meeting to the public. And so that's how I got to know Sai. That's how I got to know Kalei. That's how I got to know so many of the folks that we worked with was through this. And again, a way to earn trust. I've also written letters of recommendation of those teens for college that I really got to know. Again, so just some of those tangible examples. I think as I've been preaching this whole time, push back against our top-down tendencies. Remember, we're only experts, honestly, in a really small area. We have deep knowledge within that area, but it's really a small area. We need to collaborate with other experts, community experts, teen experts, and honestly, be humble, I think is what I really had to learn. Seek feedback and respond to feedback. I think the consistency in this has been helpful in earning that trust of, you're going to get feedback. We're going to mess up. We're going to do harm. How do we hear that, understand it, and do better and respond to that feedback? I think is something I'm working on and just encourage others to. And then I think I already said this, but own past harm research, even if you were not the one doing it, and do better. And I think that's all I have. Rob, any other comments? I know I got on my soapbox. Okay, stepping down. Beep, boop, boop.
Not at all. I think that for a 5-year partnership, which has been amazing, authentic engagement, cultural humility, those things are important, and particularly working with teens or really any group of folks for that long. The genuine, compassion and empathy that you've shown, Ashley, has been great, and that really opens up trust, right? And that's what we try to offer to our community. So, really being intentional. I've used intentionality quite a few times today, but just really intentionally prioritizing, that great engagement, compassion, empathy. You're able to build that trust. Once people trust you, we can work for 5 years and learn a lot. So I really appreciate the partnership and the work that we're doing.
Thank you both so much, Ashley and Rob. Why don't we go ahead and stop share so the audience can see faces? And we do have one. Actually, we have a couple questions submitted already. So we do have this line open to, I believe, 1:15. So folks that are able to stay on, I hope you'll join us for Q&A. And I'm going to jump right into it because we have some excellent audience questions. First, from Laura Dirks, we have hello from Oak Park. and wondering, do you have any sense of the extent that Oak Park's youth and perhaps surrounding communities rely on the public library for support? With counselors at the high school, the new community rec center, the new mental health support from the police department, there are many hands trying to wrap around teenagers here. Did you all ever ask, where do you feel lost and less comfortable asking and receiving support?
Mm. Oh, wonderful questions. Rob, do you want to speak to I may be cutting out. Rob, do you want to speak to the community reliance on the library?
Sure. So I would say honestly, since 2019-ish, and then COVID, the silver lining with COVID is that a lot of silos have broken down in Oak Park as far as how to better engage with youth teens, particularly having the community resource, the CRC, the Park District has been great resources. I'm so happy that that's happening. But there's just overall been more communication. I've been working in the community for 17 years. There's been just more open communication and breaking down silos and how to really work together to help solve and address some problems. Instead of working in silos, we can work collectively to be able to build infrastructure for folks. So hope that answers the question.
And I'll just at the end of, have you ever asked? So yes, we've asked teens, and what's pretty rad is the library. Again, those safe spaces, the trusted adults, the teen programming, the interventionists that come, they actually do feel comfortable, and even front-facing workers. So going up and asking, hey, can I have something on anxiety, was also what we saw.
All right, fantastic. Questions keep coming in. We have another from Camille Murray. Who asks, can you describe what considerations and decision-making processes influenced the choices to collect graphic data and to artistically display data in the ways that you did? What benefits, if any, do you imagine might arise from the integration of graphic data collection in adult qualitative research?
Ooh, love. Hopefully this isn't a controversial answer, but we love our data, but it's boring. And especially if people haven't had a lot of training in it, because we've had the privilege to have that training, it doesn't make sense. So I found this so helpful as a way to share back with the community, because also I think we just never share back our data, again, because it's so boring and we present it in boring ways. But I felt that this was so helpful to be like, hey, this is what we learned from you. This is, thank you so much. And I think it was really palatable by the community. But Rob, what are your thoughts?
I mean, we had conversations, many about just the best ways to share data, right? Having visual learners, right? Being able to reach as many people as possible, and how we share that data is important. And I think really it goes into the cultural humility piece as well. And then also the, really the, kind of DEI work that our organization is focusing on anyway, particularly for the past five years.
And I'll echo that. I've learned so much from Rob in the library and also ARC, because the living history, it was primarily Black youth that were interested in that programming. And I was the only white person in that group. So I had real discussions of, am I causing harm, or am I making this not a safe group by being a white presence here? So I think these conversations were throughout, and were really important to have. And again, be cognizant of things that we just really aren't as a researcher.
Thank you so much. We have another question from Lazarek Hartzog, and I have to apologize to everyone that since this isn't a Zoom meeting, people can't correct my pronunciation. So I apologize if I've mispronounced anyone's name. And the question is, I plan on going to graduate school for social work and library sciences and would love to follow along with your study, and was wondering if there are any newsletters, social media, or contact points.
Love this. Yay, inspiring others. Woo. Yes, just email me. I'll put my email in the chat and we'll talk.
Wonderful. In general, at Northwestern, we tend to be first name dot last name at northwestern.edu. So you can email Ashley at ashley.knapp@northwestern.edu. I don't see any more. Just as I was saying, there were no more questions. I heard one just snuck in by Stephen. Maybe I misheard you, but Robert Simmons, what did you mean by DEI work?
Diversity, inclusion work, basically. Like we hired a director of anti-racism and equity for the E. Stephen's been in that position for 2 years, a little over 2 years now. I mean, we went through a whole I would say we have a strategic plan for our organization, and we've really been intentional about the work and how that can be implemented internally and externally in the community. So the diversity, equity and inclusion work, we're very intentional about that as well. And I also added shared my email, rsimmons@oppl.org for those who want to reach out.
Fantastic. It looks like Ashley put both hers and yours in the chat, Rob. So thank you very much, Ashley. We also got a question which I answered, asking if this would be available to view or to share with others. And yes, this has been recorded and will be posted on the IFAM website. We have, may I ask a second question? This is Stephen again. How difficult was it to obtain funding for these efforts?
Good question. I think, oh gosh, that's a longer conversation, and I think it's a wonderful one. I will say that a lot of the federal agencies don't really think to community funding. I may be controversial on this. I think there is a swing to fund this type of research, but that's why I'm pushing. I think there needs to be a pretty big shift, honestly, a paradigm shift in understanding the expertise of communities and putting them in grants as co-Is, making sure they get paid. We paid our teen investigators and we pay everyone that we work with. So I think it's a fabulous question, and I'd love to chat more with you, but I think overall what I'll say right now is there needs to be a paradigm shift. We need to care more about the community, and one way to do that is money. And I, especially thinking of indirect and direct funds, how it goes, where it goes, I think I just challenge us to be more cognizant and let's create models. Let's think about it so that whenever we are pitching it to, let's say, National Institutes of Health, like, hey, this model shows that the community engagement, oh, we have such better work, such better science coming out of this. So I think that's also what I really encourage others to publish and think about is let's get this literature out there so that we can then say, we can really push the paradigm with institutes.
Fantastic. I think I'm going to stop there. And if any more questions come in, we will have the speakers write out responses because the trickle is a little bit hard to time. So I want to thank everyone for joining today. And I want to thank Ashley and Rob for this incredibly dynamic and engaging conversation. And I'll ask if anyone from IFAM has any parting words or if we should just bid everyone farewell.
No, but thank you.
Okay, thanks everyone. We really appreciate your attending and we look forward to continuing the conversation.
Bye guys, thanks so much.